years, people's focus with health literacy was on the individual and what they needed to do to improve. Around 2010, it was finally understood that maybe not all of the burden should be on the patient and the clients in our communities, because a big issue is with our systems. There really has not been much at all on the community-based organization and helping them learn how to make their organizations more health literate. When we opened up this program through an application process, we opened it up to any San Antonio organization who provided at least some amount of either health education, which is pretty common, or health services. So we ended up getting 3 clinics and 7 non-clinical organizations.
I'm Dr. Lisa Ochoa, and I'm founder and CEO of the SAVE Clinic, the San Antonio Vascular and Endovascular Clinic, and I'm a board-certified vascular surgeon. I can tell you that health literacy is one barrier that our patients face, and one thing that I realize that if we are going to make a big impact, we have to address health literacy also, not only within the patients and their families, but within our staff as well. With the Pledge program, it was really nice because we were recommended to make a plan and first address what our inadequacies are and figure out where we can make things better. And so some of the easy things that we implemented right away are our intake forms. And so we have an intake form where we ask something we call a review of systems, and now we've actually put an area there for patients to be able to write down their questions for the doctor. I've often found that they are excited to see here, they're glad they're here. I walk into the room and they're at a loss for words. So it seems like something so simple, but now that they have a objective place to write their questions before I walk in, I think is very helpful. And then making that in both English and Spanish.
And do you think conversations are better without all the medical jargon or all the crazy terms? And
yes, because you know, you can be telling me this and that, and I don't understand what you're telling me, you know. But if you explain it to me in people, not in doctors' language, it would be better.
We can't assume that everyone goes to the healthcare system, which are the clinics and the hospitals, the traditional healthcare, because they don't have trust in that system, or they don't have a family history of using that system, or they can't get to those clinics because they don't have transportation. And so who they end up using for their healthcare is the social service organizations, the community-based organizations. That might be a church, a food bank, a community center.
When I started hearing about the Health Confianza Health Literacy Project, I thought it was a great fit for us because we were just building a health equity department. So we're learning how to do this work well. We always are out in the community all the time, and what better way to build our skills than to learn how to properly communicate our message across. Because we hadn't really realized that we were doing healthcare work already, some things weren't correctly in place. For instance, we didn't have educational sheets. We were signing up people for mammograms, but we weren't educating them on how do you do a breast self-exam? When do you need a mammogram? What type of mammogram do you need? So all those educational pieces were missing. And so we were missing out on opportunities to really holistically take care of people. So we kind of bridged that gap to say, hey, your health is important. This is why, trust the doctor. So we have to be educated enough to push them into healthcare properly and educate them on how to take care of themselves. So yeah, we may not be touching patients directly, but we're doing that educational piece, and that's kind of really essential.
We knew we had to provide the resources and the mentorship and the technical training in order for those organizations to focus on making change in the organization. And they could be learning from each other as much as they would learn from the experts that we brought in to help guide them. And so that's how the collaborative idea of taking a pledge manifested into an actual program. After that, the organizations will earn a certificate which they can display physically, on site, which they can display on their website and social media, that announces to our community that they have gone above and beyond what other organizations have done to make sure that they're not just offering great services to their clients, but that they are making sure that their services can be used well by their clients.
Patients walk away saying, I learned something, I know something, I understand, and I hope that becomes the norm. That is what you want when you go to your doctor. That is what you want when you leave a doctor's office. I do have patients that tell me, wow, I learned so much. You're the first, this is the first time I even understand what's going on with me. If our healthcare providers, if our physicians are not actively trying to figure out how we better communicate what it means to have diabetes or what it means to have heart disease or chronic kidney disease, what they need to do and how to improve that, then we're not going to reach the healthcare outcomes that we want.
I would definitely encourage other organizations to do this work because it's going to enhance the services they provide so much more, and the community is going to benefit for that.